Hello, this is Kim Jong-il. Today, we will look at the second and third molar. It is necessary to think once again whether you have neglected this part and treated it while orthodontic treatment. What do you think about the treatment of the second and third molars, excluding treatment for anterior discrepancy such as crowding, premolar relationship, and midline deviation? This patient was undergoing orthodontic treatment at another hospital and asked me to remove brackets. There is no bracket attached to the upper and lower second molars. You can see that the lower second molar is mesially inclined. As an upper and lower premolar extraction case, a Nitai closed coil spring is used for the upper posterior teeth, and an energy chain is used for the anterior teeth to close the extraction space. Should I do debonding for this patient? If I do debonding, the upper anterior space will likely relapse again. This patient also came for the same reason. The treatment wasn't finished and came to me. All upper and lower third molars erupted. Brackets are attached only up to tooth 6 for upper and lower. Anyone can close the extraction space by extracting the premolar and putting the brackets from teeth 1 to 6. Treatment was ongoing, the anterior part became open bite, and the molar key became half class 2 relationship, making it difficult to finish. That's why he was transferred to me. Let's see this patient. Crowding of anterior part was solved by attaching brackets to teeth 1 to 6. In this case, crowding is not severe and can be easily solved with non-extraction. However, since the bracket is not attached to the tooth 7, so second molar is rotated mesially, and the upper arch form has not improved. Many doctors do not attach brackets to the upper and lower second molars. Should bracket bonding be attached to the second molars? Brackets must be attached to the upper and lower second molars, especially the lower second molars, to finish the treatment. There are many cases of mesial rotation and mesial inclination of the second molar. Derotation of the mesially rotated second molar is necessary to obtain occlusal stability. Many doctors are afraid to attach brackets to the second molar. Why? First, in the case of a high-angle case with a curve of SPI, attaching a bracket to the upper and lower second molars may lead to an open bite of the anterior part. If the anterior part become open bite, it is difficult to treat. So many doctors do not attach the brackets to the second molars from the beginning. Second, in the case of class 2 malocclusion, it is difficult to attach the brackets to the lower second molars. This is because in the case of class 2 malocclusion, the posterior vertical dimension decreases, so there is not enough space for the teeth to erupt. Therefore, it is very likely that the bracket tube will touch the upper teeth. On the other hand, it is easy to attach to the lower molar. Especially the buccal tube can be attached more easily. Third, the lower molars are often mesially rotated. If the tooth is mesially rotated, it must be derotated. If the tooth is not derotated and only anterior crowding is solved, the stability of the posterior occlusion will be decreased, and the teeth will be forced forward by the mesially rotated tooth. Let's talk about the lower arch form. The lower arch form has a circle line connecting the lower incisal edge, the cusp tip of the premolar, and the contact point of the lower first molars, and must have an egg-shaped arch form. In other words, the arch form in which the lower first molar is inclined outward is not good. Why should it be egg-shaped arch form? This is because the arch form becomes stable. Looking at the architectural arch form, A is the keystone and the upper and lower anterior teeth can be compared to this part. B will be the canine as a springer. D is the pillar and becomes the premolar and molar area. And the arch form of premolar and molar area becomes U-shape arch form as it goes to the posterior part. If you attach the bracket to the second molar and perform full leveling, the anterior part becomes an open bite or tapered arch form. Alternatively, it may be difficult to put the bracket in accurate position. So many orthodontists try not to attach the bracket to the second molar. But again, you should attach a bracket to the second molar. Let's take a look at the eruption of the posterior teeth. By the age of 6, the upper and lower first molars erupt. The upper first molar is inclined distal, and the lower first molar is inclined slightly mesial. At around 12 years of age, the upper and lower second molars erupt. At this time, the upper second molar begins to come out with the same distal inclination as the first molar, and later it will be located on the occlusal surface. On the other hand, the lower second molar has a mesial inclination. At this time, depending on the malocclusion, the timing and order of the teeth erupting may be different. In case of Class 1, the first molar of the upper and lower erupts around the age of 6 to 7 and becomes a Class 1 relationship. And the second molar of the upper and lower erupts between the ages of 11 and 12, maintaining the Class 1 relationship. Let's look at a case, 7-year-old patient. Looking at the panorama, the lower first molar has already erupted, but the upper first molar has not erupted yet. Perhaps it will take at least 6 months for this patient's upper first molars to erupt. Also, because the dental arch of the maxilla is narrow, teeth 1, 2, 3, 4, and 5 have insufficient space to erupt. The next case is an 11-year-old patient. Since APDI is 87, it is a Class 3 malocclusion. You can see the lower second molars erupting. However, the upper second molars have not erupted yet. Probably 1 or 2 years later, it will erupt. In Class 3, the eruption of the first and second molars of the maxilla is relatively slow. Let's look at this case. APDI is 75 and it is Class 2. From the panorama view, you can see that the lower second molars are located on the same line as the first molars. However, in intraoral photos, you can see only the cusps of lower second molars. Why is that? In the case of Class 2 malocclusion, this is because the mandible is located posteriorly due to the mandibular undergrowth. In panorama view, it seems almost all erupted. But when viewed from the oral cavity, there was not enough space to erupt, so it couldn't find its location. The order in which the second molars erupt can be divided into the cases of Class 1, 2, and 3. In Class 2 malocclusion, the upper second molars erupt 1 year or 1.5 years earlier than the lower second molars. In Class 3 malocclusion, the lower second molars erupt 1 year or 1.5 years earlier than the upper second molars. This is a 10-year-old Class 3 malocclusion patient. The upper tooth 7 is not visible in panorama. In panorama after orthodontic treatment, the upper tooth 7 has the shape of the tooth 8. However, it erupted too late and has become almost unusable. In this way, it is important to keep in mind that the order of eruption of the second molars in Class 2 and 3 malocclusion may be different. As previously lectured, I said that the second molar must be adjusted. In particular, the upper second molars are often mesially rotated. The lower second molars often have mesial rotation and mesial inclination. So, the upper second molars needs to be derotated, and the lower second molars needs to be derotated and uprighted. 8-year-old Class 3 malocclusion patient. In panorama, the upper first molar on the left side erupted, but the first molar on the right side did not erupt. At this time, the midline will be shifted to the right. 11-year-old Class 3 malocclusion patient. In panorama, you can see that the lower second molar erupted well. What about the upper second molar? It is located on the higher side. It is likely to erupt in about 2 years. You should observe the eruption of the upper first, second, and third molars in Class 3 malocclusion. In general, the upper first molar erupts around the age of 6 years, and the upper second molar erupts around the age of 12. The upper third molar erupts around the age of 18. However, the upper first molars may erupt late between the ages of 6 to 12, that is, around the age of 8 to 9. In this case, the anterior growth of the maxilla is delayed, and the mandible is more likely to be located anteriorly. Because of this, the upper second molar, which usually erupts around the age of 12, also erupts late around the age of 15. Posterior discrepancy should always be considered if the upper first, second, and third molars erupt late. The possibility of over-eruption of the upper first molars increases, which slows the growth of the maxilla and increases the likelihood of relapse. Again, you need to look carefully at the posterior part. In Class 2 malocclusion, the mandible is often located posteriorly. Let's look at a case of mandible is located posteriorly. On the right side, it erupted well to the lower second molar, and the third molar is also visible. On the other hand, what about the left side? It is a congenital missing of the lower second premolar. You can see that teeth 4, 6, and 7 erupted late. Is non-extraction treatment possible at this time? Tooth 7 should be moved posteriorly. If tooth 6 is moved backward, there is a high possibility that the erupting tooth 7 will be impacted. Let's review again the discrepancy of the anterior and posterior parts. The discrepancy in front of the tooth 6 is called anterior discrepancy, and the discrepancy in the back of the tooth 6 is called posterior discrepancy. There are many cases of posterior discrepancy. Anyone can easily tell if there is impaction like this. However, in other cases, the anterior part may be affected by posterior discrepancy. We should check the eruption space at the posterior. How should we check it? In the maxilla, the distance from the mesial plane of the first molar to the PNS. In the mandibular, the distance from the mesial plane of the first molar to the ramus anterior border. These should be checked if there is enough space. In this panorama, you can see lower tooth 6, 7, and 8. This tooth 8 is likely to be impacted and will push the lower teeth forward. In posterior discrepancy, there is a high possibility that the anterior teeth of the upper and lower will be mesially inclined. In occlusal plane, there is a high possibility of mesial rotation. How will it look from the front? There will be many cases where the lower teeth are lingually inclined or the upper teeth has a scissor bite. As the upper second molar rotates mesially, the first molar may also rotate mesially too. Alternatively, the first molar may be mesially rotated as the upper second molar shows a scissor bite. In these cases, it makes no sense to align only the anterior teeth. Professor Sato said that if there is posterior discrepancy, the following tooth movement occurs. As the third molar erupts, the second molar and the first molar are over-erupted, or the posterior molar may be inclined mesially. The anterior teeth are also mesially inclined by the mesial inclination of the posterior teeth, and crowding may occur in the anterior teeth. How should we treat it? If there is posterior discrepancy, some posterior tooth should be extracted. In the case of molar over-eruption, the posterior teeth should be intruded. And in the case of mesial inclination, it should be uprighted. How should we do it? The upper and lower third molars can be extracted, and in some cases the upper second molar and lower third molars can be extracted. In the case of extracting the upper second molars, the third molars replace the second molars. So, in cases of posterior discrepancy, the posterior sum tooth is extracted. Normally, it is third molar tooth extraction. Then, strategic leveling is performed, and the mesially inclined posterior teeth are uprighted using meow, and the over-erupted posterior teeth are intruded. Therefore, when making a diagnosis, you should check not only the anterior discrepancy, but also the posterior discrepancy, that is, the second and third molar. Thank you for watching.